Have you ever brushed off a cough, a little shortness of breath, or feeling unusually tired and told yourself it's just age, stress, or maybe the weather? What if I told you that in the time it takes to watch this video, 3 people will lose their lives to lung cancer? That's 1 death every 3 minutes faster than brewing a cup of coffee. And here's the terrifying truth: most of those deaths didn't have to happen. They weren't caused by sudden accidents or unstoppable genetics. They happened because the early warning signs were ignored, mistaken for something harmless, or simply dismissed as part of everyday life. I'm Dr. Mark Ellis, and today I'm going to walk you through the 12 scientifically proven symptoms that could mean the difference between life and death. Catch lung cancer early, and survival rates soar to over 60%. Miss the signs, and that number crashes to a frightening 6. That's not a statistic. That's the razor-thin line between years of life gained or stolen away too soon. So if you've ever wondered whether your body is trying to whisper a warning you've been too busy to hear, stay with me. Because what you learn in the next few minutes might just save your life or the life of someone you love. And to truly understand how deceptive this disease can be, let's begin with the single most common symptom almost everyone dismisses until it's too late. The very first sign you must never ignore is a persistent cough. Now, I'm not talking about the little tickle you get during allergy season or the cough that fades after a cold. This is the kind that lingers, the one that becomes a background soundtrack to your life, creeping into your mornings, your meetings, even your sleep. I once had a patient, a 59-year-old school teacher named Margaret, who brushed it off for nearly 6 months. She thought it was post-nasal drip, tried lozenges, honey, even over-the-counter meds. Nothing worked. By the time she sought help, the cough had been her body's desperate alarm bell, warning her of something far more serious. According to the American Cancer Society's 2023 research, nearly 75% of lung cancer patients already had a persistent cough by the time of diagnosis. The reason it's so dangerous is that it mimics everyday problems, bronchitis, acid reflux, seasonal allergies. But unlike those, a cancer-related cough doesn't follow the usual script. It starts dry and hacking, often worse at night, robbing you of sleep and slowly wearing down your energy reserves. And here's the chilling part: it can seem to improve for a week or two, only to return stronger. That false sense of recovery is one of lung cancer's cruelest tricks. So here's the truth you can't afford to forget: if a cough refuses to leave after 3 weeks, if it keeps coming back, or if it changes in sound or intensity, it's not just annoying. It's a red flag that demands a doctor's attention immediately. Your lungs are too vital to gamble with. But just recognizing the cough isn't enough, because there's another warning sign that often sneaks in alongside it. And this one is even more terrifying. But only knowing this isn't enough, because there's another hidden factor that quietly drains your breath. And most people mistake it for simply getting older. Right after a stubborn cough, the next red flag your body may be waving is shortness of breath. At first, it's subtle. Maybe you notice climbing the stairs leaves you more winded than usual, or carrying groceries suddenly feels like you just ran a sprint. Most people dismiss it as being out of shape or simply getting older. That's exactly what my patient Robert, a 64-year-old retired carpenter, thought. He ignored the slow changes until one day he realized he was struggling to breathe while just tying his shoes. Science tells us why this is so alarming. According to Mayo Clinic research in 2023, nearly 60% of lung cancer patients report some level of breathlessness. Here's what's happening inside: tumors can physically block airways while fluid builds up around the lungs, forcing your body to work harder for every single breath. Patients often describe it as breathing through a straw or carrying a heavy weight on their chest. And the tragedy: it develops so gradually that you unconsciously adjust your lifestyle. You walk slower, rest more often, avoid the activities you once loved without realizing you're shrinking your life to fit the disease. If shortness of breath creeps into your daily routine and doesn't improve with rest, don't brush it off. It's your body screaming that something deeper is wrong, and it deserves medical attention right away. Ignoring it can mean the difference between catching a tumor early and facing it too late. But breathlessness is just one piece of this deadly puzzle, because the next warning sign hides even better, often masquerading as something completely harmless. But only knowing this isn't enough, because there's another subtle signal felt in the chest itself that most people write off as nothing more than muscle strain. Another warning sign that slips under the radar is chest pain. Now, when most people hear chest pain, they immediately think of heart attacks, something dramatic and crushing. But lung cancer chest pain is very different. It often starts as a dull ache, an occasional discomfort you brush off as heartburn, sore muscles, or maybe arthritis. That's exactly what happened to Linda, a 57-year-old office worker. She ignored the strange twinges on one side of her chest for months, chalking it up to bad posture at her desk. By the time she realized it wasn't going away, the pain had already become constant, keeping her awake at night. According to the National Cancer Institute, chest pain in lung cancer is usually a result of tumors pressing against nerves, ribs, or the chest wall. It can present in many ways: a gnawing ache, sharp stabbing bursts, or pain that radiates to the shoulder, back, or even down the arm. What makes it so deceptive is how ordinary it feels. Deep breaths, coughing, or even laughing can make it worse, but it never completely disappears. And here's the frightening part: when the pain reaches that point, it often means the tumor has grown large enough to invade surrounding structures. If you're experiencing chest discomfort that lingers, don't assume it's just strain or indigestion. Persistent, localized pain is your body's way of waving a red flag, begging you to pay attention before it's too late. Because while chest pain is alarming, the next symptom is even more surprising, one that most people never connect to their lungs until it's already too advanced. But only knowing this isn't enough, because the next sign doesn't come from your chest at all, it comes from your voice. And the change can be shockingly easy to miss. One of the most surprising signs of lung cancer doesn't start in your chest at all, it shows up in your voice. Imagine waking up and sounding hoarse, raspy, or weaker than usual. Most people shrug it off, thinking it's from talking too much, allergies, or maybe acid reflux. That's exactly what happened to James, a 61-year-old grandfather. He noticed his voice changing slowly over months, but since it didn't hurt, he simply ignored it. By the time he finally saw a doctor, the tumor had already pressed against a critical nerve that controls the vocal cords. Research published in the Journal of Thoracic Oncology shows that nearly 1 in 5 lung cancer patients develop hoarseness. The mechanism is both fascinating and frightening. Tumors growing near the recurrent laryngeal nerve can partially paralyze the vocal cords, leaving the voice sounding strained, weak, or not quite right. What makes this especially dangerous is how persistent it is. Unlike hoarseness from a cold or shouting at a sports game, this change doesn't improve with rest, hydration, or home remedies. It lingers, deepens, and eventually can progress to full voice loss if the tumor keeps growing. If your voice suddenly sounds different for more than 2 or 3 weeks, don't dismiss it. It might not be your throat at all. It could be your lungs sending a warning. Because when cancer affects your voice, it's already interfering with the delicate nerves that control basic functions of speaking and breathing. And while hoarseness is unsettling, the next symptom can feel even more shocking, because it shows up in your appearance before you even realize what's happening inside. But only knowing this isn't enough, because the next sign reveals itself on the scale, and that silent, unexplained weight loss can be far more dangerous than most people ever imagine. Now let's talk about a symptom that tricks almost everyone: unexplained weight loss. At first, many people actually welcome it. Imagine stepping on the scale and seeing 10 or 15 pounds vanish without changing your diet or exercise. For Sarah, a 63-year-old grandmother, this felt like a blessing. She thought, finally, the pounds are melting away. But what she didn't realize was that the cancer inside her lungs was consuming her body's fuel. stealing nutrients from her muscles and tissues to feed its relentless growth. Cancer Research UK reports that nearly 60% of lung cancer patients experience unintentional weight loss of more than 5% of their body weight within just 6 months. The science behind it is brutal. Cancer cells hijack your metabolism, forcing your body to burn calories at an accelerated rate, even when you're resting. On top of that, lung cancer can alter taste and appetite, making food less appealing, and creating a vicious cycle where you eat less while your body demands more. Clothes fit looser, belts need new notches, and family members start asking, "Are you okay? You look thinner." These small changes can actually be life-saving clues if you take them seriously. If the weight is slipping away without a clear reason, don't celebrate too soon. It could be your body sounding the alarm that something much deeper is wrong. And while weight loss is a silent thief, the next symptom can feel like a tidal wave because it doesn't just drain your body, it drains every ounce of energy from your life. But only knowing this isn't enough, because the next sign strikes harder than fatigue from a busy day. It's a crushing exhaustion that sleep can't fix, and it may be the most overwhelming symptom of all. Few symptoms feel as relentless as cancer-related fatigue. This isn't the tiredness you shake off with a good night's sleep or a strong cup of coffee. This is a bone-deep exhaustion that follows you everywhere, making even simple tasks feel impossible. Take Michael, a 67-year-old retired mechanic. He used to spend his mornings tinkering in the garage, but then came days when just reading the newspaper left him drained. He told me it felt like someone had stolen the batteries out of his body. The National Comprehensive Cancer Network reports that up to 95% of lung cancer patients suffer from this kind of fatigue. And here's the science behind it. Cancer cells divert your body's energy supply for themselves, essentially starving your muscles and brain. On top of that, lung cancer can trigger anemia, lowering your red blood cells and cutting down the oxygen your body desperately needs to function. That's why the exhaustion isn't just physical, it clouds the mind too. Patients describe brain fog, struggling to concentrate, forgetting conversations, or losing the thread of a TV show they've watched for years. So if you find yourself collapsing into bed after minor chores or battling constant brain fog, it's not laziness, and it's not normal aging. It could be a critical warning that something bigger is draining your life force from within. And while fatigue is devastating, the next symptom can be even more frightening because when it appears, the warning is impossible to ignore. But only knowing this isn't enough, because the next sign doesn't hide in your energy, it shows up in your spit. And even a streak of blood can be the clue that saves your life. Few symptoms stop people in their tracks like coughing up blood. Even the tiniest streak in the sink or on a tissue can send a chill down your spine. But here's the danger. Too many people see just a little pink or rust-colored spot and convince themselves it's nothing serious. Maybe a burst capillary or irritation. That's what happened to Elena, a 55-year-old nurse. She dismissed the faint red streaks in her morning sputum for weeks, thinking her dry throat was to blame. By the time she sought medical help, the cancer had already spread. According to Cleveland Clinic research, about 1 in 4 lung cancer patients experience some level of blood in their sputum. It can look like bright red streaks, tiny clots, or even give mucus a pinkish tinge. What makes it so deceptive is that the amount of blood doesn't match the danger level. Even a trace can mean a tumor is eroding fragile blood vessels inside the lungs. As tumors grow, the bleeding can worsen suddenly and without warning. Ignoring this sign even once can mean missing a chance at early detection. If you ever see unexplained blood when you cough, don't wait, don't guess, and don't self-treat. It demands immediate medical attention, because sometimes the smallest stain carries the biggest warning, and while blood is shocking to witness, the next symptom can hide in plain sight, pretending to be something as ordinary as the flu. But only knowing this isn't enough, because the next sign isn't about what comes out of your lungs, it's about what keeps going back in, as repeated infections silently point to something much darker. One of the most overlooked red flags is getting lung infections over and over again, A bout of bronchitis here, a case of pneumonia there. Most people think they're just unlucky or maybe have a weak immune system. That's exactly what happened to David, a 60-year-old bus driver. He kept catching what doctors thought were routine chest infections, treated with round after round of antibiotics. Each time, the symptoms cleared for a while, but within months, the same infection returned. Only later did scans reveal a tumor was blocking part of his airway, creating the perfect breeding ground for bacteria. The American Lung Association warns that repeated lung infections, especially if they happen in the same spot, can be an early clue of lung cancer. Tumors narrow or obstruct the airways, trapping mucus and creating warm, moist pockets where bacteria thrive. Normal lung tissue has ways to flush out invaders, but when a tumor interrupts that process, infections keep coming back. This cycle of temporary relief followed by relapse can fool both patients and doctors, wasting precious time before the real cause is uncovered. So if you're catching pneumonia or bronchitis again and again, and it always seems to hit the same area, don't just accept another prescription. Ask for deeper testing, because recurring infections may not be the enemy, they may be the messenger. And while infections are frustrating, the next sign is even trickier, because it whispers through your breath in a sound most people mistake for something else entirely. But only knowing this isn't enough, because the next warning doesn't arrive as fever or cough, it comes as a faint whistle in your chest. And most people confuse it with asthma until it's far too late. Another warning your lungs may be sending is wheezing. Picture this: you're lying in bed at night and suddenly you hear a faint whistle or squeak in your chest as you breathe. Most people think it's just asthma, or maybe allergies acting up again. That's exactly what happened to Karen, a 58-year-old grandmother. She had never had asthma in her life, but when the wheezing started, she convinced herself it was just part of getting older. Unfortunately, what she didn't know was that a tumor was slowly narrowing one of her airways, creating turbulence with every breath she took. Research in the Annals of Internal Medicine highlights that new-onset wheezing in adults, especially after age 40, can be a hidden sign of lung cancer. Unlike asthma, which usually affects both lungs and responds to inhalers, cancer-related wheezing often happens on just one side and keeps getting worse no matter what you try. Patients describe it as a whistle, a squeak, or even a rattling sound that feels out of place and strangely persistent. It doesn't come and go with pollen season, and it doesn't clear up with over-the-counter treatments. If you suddenly develop wheezing as an adult, especially if you've never had asthma before, don't brush it off as just allergies. It may be your lungs struggling against a silent blockage that needs urgent investigation. And while wheezing is unsettling, the next symptom can be even more visible because this time, the warning shows up right on your face. But only knowing this isn't enough, because the next sign doesn't whisper through your breath, it swells across your face and neck. And the reason behind it is far more serious than most people realize. Sometimes the most alarming warnings don't come from your lungs at all, they show up on your face. Imagine waking up one morning and noticing your face looks puffier than usual, or your neck feels tight. That's exactly what happened to John, a 62-year-old veteran. At first, he thought it was just from sleeping funny or eating too much salty food. But over time, the swelling grew worse, especially in the mornings, until the veins in his neck started to bulge. What he didn't know was that a tumor deep in his chest was pressing on a major vein, slowing the blood returning to his heart. Doctors call this superior vena cava syndrome, and research published in the Journal of Clinical Oncology confirms it's a red flag for advanced lung cancer. When a tumor compresses that large vein, blood backs up in the upper body, causing swelling in the face, neck, and sometimes even the arms. The skin can take on a reddish or purplish tone, and people may feel pressure in the head or trouble swallowing. Because it happens gradually, many dismiss it until the swelling becomes impossible to ignore. By that point, the cancer has usually grown large enough to threaten not only comfort, but survival. If your face or neck looks swollen day after day, and you can't connect it to allergies, diet, or medications, don't wait. This is one of the clearest outward signs that something inside your chest may be dangerously wrong. And while facial swelling is hard to miss, the next symptom can be even more devastating because when it appears, it often means the cancer has already begun to travel beyond the lungs. But only knowing this isn't enough, because the next sign doesn't show up on the surface. It strikes deep in the bones, bringing a pain that refuses to fade away. One of the most painful signs that lung cancer may be advancing is bone pain. Unlike the stiffness of arthritis that eases when you rest, cancer-related bone pain digs deep and refuses to let go. I'll never forget Margaret, a 65-year-old retired teacher. She first noticed a dull ache in her back that wouldn't go away. At night, the pain grew sharper, waking her from sleep. She tried heating pads, pain relievers, even physical therapy, but nothing worked. Later, scans revealed the cancer had spread to her spine. According to MD Anderson Cancer Center, up to 40% of patients with advanced lung cancer develop bone metastases, most often in the ribs, spine, hips, or long bones. The pain can feel like a constant ache, or it can radiate down the legs or arms depending on where the cancer has spread. What makes this so dangerous is how easily it's mistaken for routine back pain, old sports injuries, or just getting older. But unlike those, cancer pain doesn't fade with rest, it only grows more relentless. If you're experiencing bone pain that lingers for weeks or worsens at night, don't dismiss it as age or arthritis. It could be your body's way of signaling something far more serious happening inside. And as frightening as bone pain is, the next sign takes things to an entirely different level because when cancer reaches this stage, it begins to interfere with the very center of who you are. But only knowing this isn't enough, because the next sign doesn't just affect your body, it invades your brain, altering your balance, your memory, even your personality in ways you may never expect. Perhaps the most unsettling warning signs are the ones that don't even seem connected to the lungs at all, neurological symptoms. Imagine waking up with pounding headaches that feel worse in the morning, or suddenly losing your balance when you stand. That's what happened to Patricia, a 60-year-old accountant. At first, she thought it was just stress, maybe even migraines. But then came the moments of confusion forgetting familiar names, struggling to find the right word mid-sentence. Eventually, she experienced a seizure that sent her to the hospital, where doctors discovered lung cancer that had spread to her brain. The National Cancer Institute reports that up to 25% of lung cancer patients develop brain metastases. These changes can manifest in subtle ways: headaches that don't respond to normal medications, dizziness, clumsiness, or even sudden personality shifts. Some patients notice blurred vision or problems with coordination. Because these symptoms develop gradually, they're often brushed aside until they disrupt daily life. But when lung cancer reaches the brain, it means the disease has already taken a dangerous step forward. If you or someone you love is dealing with unexplained neurological changes, especially alongside other symptoms we've discussed, it's critical to push for answers. These are not just random events. They can be your body's final, desperate signal. And while neurological symptoms are terrifying, they lead us to the next life-saving step, knowing what medical tests to request. Because recognizing symptoms is only half the battle. Confirming the truth with the right scans and procedures can mean the difference between catching lung cancer early or too late. But only knowing this isn't enough, because the next step isn't about spotting signs. It's about demanding the tests that reveal what's really happening inside your lungs before it's too late. I know today's video may have felt heavy, but remember, this awareness is not meant to scare you. It's meant to empower you. By listening to your body and recognizing these signs, you've already taken the first step toward protecting yourself and the people you love. So please save this video so you can come back to it whenever you need a reminder, and subscribe to our channel for the latest health knowledge that could one day save your life. Your health journey doesn't have to be one of fear. It can be one of strength, awareness, and hope. Because catching problems early, seeking care, and making informed choices can change everything. You are not alone in this fight, and together, we can build a healthier future.